Maternal mortality remains a major global challenge, including here in Kenya. Despite progress, achieving our goals for newborn and maternal health requires innovations. Access to essential care like ultrasound is crucial but often limited. There's limited equipment, trained staff, and costs are again a major barrier. We at the ministry recognize this challenge. The point-of-care ultrasound offers a powerful solution. Point-of-care ultrasound allows for early intervention and timely referral, improving both maternal and fetal outcomes. And the Ministry of Health is committed to expanding access to obstetric point-of-care ultrasound, especially in the underserved areas. Over the past years, we developed the National Obstetric Point-of-Care Ultrasound Guidelines 2024, and this aligns with our national health policy and reflects our commitment to high-quality care for all Kenyans. These guidelines standardize obstetric point-of-care ultrasound services across different healthcare levels. They are a valuable resource for policymakers, health workers, and training institutions. The O-POCUS guidelines ensure proper implementation and clarify roles for healthcare professionals. This allows for informed decision-making, improving efficiency, and as well as health outcomes in mothers and babies. And this integration of obstetric point-of-care ultrasound is indeed a significant advancement for maternal and fetal health. It marks a milestone in our collective efforts to improve maternal and neonatal health across Kenya. And by expanding our obstetric point-of-care ultrasound, there will be access across healthcare levels, and we move closer to achieving universal health coverage. These guidelines equally are a cornerstone for maternal healthcare advancement, and so we encourage institutions, academias, and practitioners to embrace and implement it for better outcomes among our mothers and children. So let's work together to ensure all pregnant women in Kenya receive the highest standards of care empowered by this technology. Together, we can create a future with healthier mothers and babies.
Based on what you used to have previously called Linda Mama, the package has been enhanced to ensure that mothers and children can be able to access the best healthcare services. Our maternal mortality ratio stands at 355 per 100,000 live births. However, out of 10 women delivering in Kenya, 9 actually deliver in a health facility. It is with that, therefore, that we should be able to have a lower maternal mortality ratio than we actually have currently. It is through such innovations as these guidelines that we are going to release today that we can be able to impact the health of mothers and children, especially in the rural underserved communities. The progress in terms of maternal newborn health in this country has been unequal. If you look at the progress, you'll find some counties have made significant progress, others still lagging behind. Their statistics actually look like war zone statistics. And therefore, in the spirit of universal health coverage, we want to ensure that nobody is left behind in this. The WHO, in its guidelines of 2018, requires that a mother at least has at least one ultrasound within the first 24 weeks of pregnancy. As low middle income developing countries, we have not been able to achieve this target because most of our mothers start their antenatal care much later in pregnancy, so that they cannot not be able to benefit from that ultrasound on or before the 24th week. That time is critical because we can be able to date the pregnancy accurately. We can be able to rule out any malformations or anomalies in the baby. And then we can also be able to ensure that we diagnose whether the mother is carrying a single baby or more than one baby, and in future also prevent unnecessary inductions of labor when they reach term, and ensure that the mother has a good pregnancy experience. Your Excellency, it is with this in mind that we have decided, in line with our universal health coverage, which is premised on a primary health care approach, to be able to go into this direction of innovation, that we can be able to have a point of care ultrasound that can be deployed at the primary healthcare unit, because primary healthcare services promote, they are more integrated, they promote inclusive and complementary services, ensuring equity and inclusivity. And I think this will go a long way in ensuring that we can be able to meet the WHO target, but also the pregnant mothers can be able to have a unique experience during their pregnancy and childbirth.